Today, I'm going to give you some advice on how to tell if an autism school or program is right for your child or client. Hi, I'm Dr. Mary Barbera, autism mom, board-certified behavior analyst, and best-selling author. As you may know, I worked as the lead behavior analyst for the Pennsylvania Verbal Behavior Project from 2003 to 2010. It is now known as the Patton Autism ABA Supports Initiative, and when I was working there, it was the Pennsylvania Verbal Behavior Project. This was a statewide grant, and we were in public school autism classrooms providing guided practice for teachers, speech and language pathologists, OTs, paraprofessionals. I even trained cafeteria aides and bus drivers on some of the principles of applied behavior analysis. I've also done many independent evaluations in the past looking at whether a particular program was a good fit for a particular student. Now, I do want to say that my background is working with early intervention, 5 and under, of any ability, any functioning level within the autism spectrum. And then 6 and older, I have been focusing on kids with moderate to severe autism. So when I'm talking about a placement, generally these tips are going to be based on those kids with moderate to severe autism. Although some of these tips will also help you look at a program for a child with higher language abilities. So there are some components. The first one is that because I'm the author of the verbal behavior approach, and that has been my background as long as I've been a behavior analyst, I am a big proponent of everything being based on a verbal behavior assessment, and I specifically use the VB-MAP assessment, again, for those kids 5 and under of any ability level, and then for older kids with moderate to severe autism. I think this assessment, the VB-MAP assessment, gives us a really good guide on what should be happening within a school or program. It may not be the only assessment. We may have to do other assessments, especially for older children, but I do think it provides a nice base so that the number one thing I look for is a verbal behavior assessment being done, and is it then leading to individualized IEP goals based on that assessment, individually scheduling based on that assessment. So the goals, the plan, everything needs to be driven by the assessment. In the past, I've seen kids entering a school program and they kind of get pat IEP goals, and they're not based on that individual's assessment, and they're not based on verbal behavior assessment in particular. So after starting with an assessment and making all the goals and programs based on that assessment, the number 2 thing I look for in a school or a autism program is the classroom schedule. If my child was in there, I would want to know what his schedule looks like. Is it broken down, or is it just very loose? Is it broken down into time where you are working on the goals? The classroom is providing instruction, or are there large chunks of the day, for instance, arrival time from 9 until 9:30, then free play. These are kind of times that aren't instruction times, in my opinion, and we should really be looking at very limited time where there's no structure and no teaching being done. So I look at the schedule and make sure that everything in there gives us the most bang for our buck in terms of instruction and progress. So a VB map assessment, following a schedule. The number 3 thing I look for is on that schedule, and in actuality, is one-to-one teaching time. Our kids with moderate to severe autism tend to be very behind, have a lot of goals to work on, and need the structure of one-to-one teaching time. I've seen classrooms in schools where it's 2-to-1. There's never any 1-to-1. I've seen classrooms where it's 8-to-1 or 8-to-2, and there's no one-to-one teaching time. And it really can't be done to make progress on these individualized goals when there's so much group instruction and no one-to-one time. The next thing I look for is the child happy to go to the school, to go into the classroom, to ride on the bus, or however he gets there. The child should be happy to go to school or to their program. They should be not having problem behavior, especially on arrival. They should not be whining about going, crying, flopping to the ground when they're entering. If they are, then the program is not using the right reinforcement system, and the demands are probably too high and the reinforcement is probably too low. I also look for data collection, graphing, especially on those key areas like language, or if you're potty training, we would need to see data and graphs to show whether that is working or not. And finally, I look for a lot of parent training, collaboration, communication. I don't like to see communication sheets that come home and just have a smiley or a frowny face, had a tough day, had a great day. I, as a parent, always appreciated and needed much more details about problem behaviors and anything that went wrong in the day because my child was not able to tell me. And we really needed to work as a team to make sure that there was homeschool collaboration. So those are the 6 things I look for when I'm evaluating whether a school or program is right for your child or client. If you'd like to learn more about how to get started or revamp your program for your child or client, you can download my new 3-step guide to help you turn autism around in your toddler or your older child or teen starting today. So download the free guide, and I'll see you next week.